Hi, it's Dr. Preston. We're going to do our injection tutorial. You may have already gone over this with your doctor. If not, these are the things you'll be receiving. So you'll have your peptide. In this case, we've got tesamorelin, ipamorelin. You could use Sermorelin. The dose differs, so make sure you follow instructions, but generally you'll have a big syringe. It can be pre-filled, or if you're getting it shipped, you'll receive little vials. And each of these are 1 ml, okay? So you're gonna pop the lid off your powder substance, so it's only powders, no liquid. Then you're gonna go ahead and pop the lids off the tiny bacteria static water, okay? So there's 1, 2, 3. And so you take the lid off. You're gonna be careful not to poke yourself. And you wanna turn the vial upside down. This is kind of a way to hold it, thumb and 2 forefingers. And you kind of wanna use those back fingers to brace the water. So you'll see about 1 ml will come out, okay? And you're gonna do that with the second one. Pull out another ml. You may need to pull the needle down as the water goes down. And then the last one, you'll see it's enough. It's a little bit more than 3, so that's all you need to do is 3. Some will be 2.5. Just follow your instructions, but in general, you're taking the water. You want to tap, 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 make sure the bubbles are out. You can feel free to dribble a little water out. It's still at the 3. You're going to take your growth hormone release peptide and you're going to inject your directed amount of water. And there's a little circle on the top that you want to aim for. And then the water just gets sucked in. It is under a vacuum. So you want to make sure all the product is mixed. It'll be a little foamy. That's okay. You no longer need any of that. If you have a sharps container, that's a great way to get rid of it, or an empty jar. And then you will receive a insulin syringe. This one's pretty tiny. This one's 1/3 of an ml, or 30 units. Okay. So with what you now have, your reconstituted medication. If you're doing 200 dose of your Sermorelin, you're gonna do 12.5. So you'll see you wanna pull the top of the plunger all the way about in between the 10 and the 15. And it's good to do it beforehand. And then you're gonna put it upside down, turn your vial upside down, push it in. You can push the air in first, and then you're gonna pull it back down to, again, your directed amount. It may be different. 12.5 is 200 micrograms, 250, maybe 15, or you may need to pull it to 20. So, or 0.2 mLs, okay? So wherever you're directed, and that's it. You can also tap, 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 and then you're ready to inject. And the simple way to do that is you're just gonna pinch your fat, your stomach fat, just like this, and you wanna use a darting action as fast as you can. That way you avoid bruising. The slower you can get some more bruising. So you wanna use like a dart. I use the thumb and the middle finger, and then you have this back second finger to push the medication in. Once you've injected it, hold it there for about 5 seconds, and then you can pull it out. That makes sure, 1, the medication is there, 2, you've put some pressure on there and you won't bleed. But as soon as you pull it out, put some pressure on that with a cotton ball so you don't bruise or bleed. So your Sermorelin now is ready to go. Or your ipamorelin, or your growth hormone release peptide. In general, this can be used for general guidance. Thank you.